During Breast Cancer Awareness Month, the focus this year is on the future of treatment. Doctors say we've entered a new era of personalized medicine where therapies are tailored to each patient's genetics, tumor type, and even lifestyle factors. Now, the Winship Cancer Institute of Emory University is using genetic testing, clinical trials, and even acupuncture to tailor or to look at treatments to improve the quality of life for breast cancer patients. Let's dive into that research right now with Dr. Demetria Smith-Graziani. Welcome to the show.
Hi, thanks so much for having me.
Absolutely. How has breast cancer treatment evolved from one-size-fits-all approach to personalized therapies, which we were talking about?
Yeah, so over time, we really become better at figuring out specific differences in each person's breast cancer, whether that's the subtype, meaning is it what we call hormone receptor positive, feeding off of estrogen and progesterone in the body? Is it a HER2 positive breast cancer or a triple negative breast cancer? And that information allows us to really tailor treatments. In addition, we've been able to get information about each person's genetics of their specific cancer and even inherited genes that affect their breast cancer risk.
We understand this to be precision medicine. What does that actually look like for a patient? How do you tailor that treatment to a specific cancer?
Sure. So when a patient comes in, we determine which subtype of breast cancer they have. And then depending on that subtype, we do additional testing. That might mean looking at certain mutations in the cancer itself that help us estimate the risk of the breast cancer coming back and the benefit from treatments such as chemotherapy. And in other situations, we might look at specific mutations that can be targeted by medications, either those that are already FDA approved or those that are in clinical trials.
Doc, your current trial focuses on managing joint pain in Black postmenopausal women receiving hormone therapy. Why is that population such an important focus for you?
So even though we know that taking these anti-estrogen medications for anywhere from 5 to 10 years can reduce the risk of a hormone receptor breast cancer coming back by up to 50%, we really only have about 30 to 50% of patients that continue the treatments for the entire time. And a huge reason for the discontinuation is because of side effects. We know that Black women have a higher mortality rate compared to white women when they do develop breast cancer. And I'm trying to figure out if there's a link between discontinuing these medications early because of side effects and the risk of recurrence. So in this trial, we are giving acupuncture at the time that women start their anti-estrogen medication to hopefully reduce the incidence of joint pains that people tend to develop when they take these medications.
For a patient who just received the diagnosis, right, how soon should they ask for personalized or targeted therapies might apply to them?
Really at the first visit, you can start asking what treatments are available to me. Are clinical trials an option for me? Ask all of these questions at the beginning. There's a lot of information on the internet and elsewhere, and your doctor can really help you work through all of that and figure out what applies to you.
All right. Thanks so much, Doc. Really appreciate you joining us, and thanks so much for this insight. A very important month that we recognize for women to start getting checked if they haven't been so. So thanks so much.